use the chat box to introduce yourself. So say your name, the organization you work from, and also where you're joining us from. I see lots of familiar faces as well, so nice to see you all, and really pleased to meet virtually. Some of you will be joining us for the first time today. So moving forward during the session, please make use of the chat box, ask questions at any points. My colleagues will be collecting those questions, and there will be a session later on where we can actually go through those questions and potentially giving you the answer you're looking for. Please ensure that you specify your name and the name of the organization you work for in your username. And please keep yourself on mute while other people are speaking. And the event will be recorded. So if you don't wish to appear in the recording, please make sure that your camera is off. And following the event, we'll be circulating an email with the recording and further resources linked to the topics that we're going to cover today. And lastly, if you would like to make some noise on social media, please use the hashtag @NPCThings. And I think we are good to go. So again, thanks for joining us today. Today we're going to cover a topic which is particularly dear to me, but hopefully many of you, which is why you're here today. And it's how we can use need and demand data to inform decision making. And to talk about this particular subject, we're going to use a practical example, which is what we call FIND, the Local Needs Data Bank. I will be sharing more about this later on if you're not familiar with it. But I will be joined by amazing speakers. Those people have been fantastic so far. Have been collaborating to this initiative. So Pip Johnson from Turn to Us, Amelia Smith from Battle UK, and Jessica Taplin from British Gas Energy Trust. They will do some interventions and introductions later on. So before we go into the session, this is the agenda for the day. I'm going to give you a brief history about the data bank, the things that we've done so far, the issues, barriers, and opportunities that we try to mitigate and maximize through this collaboration and initiative. And then you will be hearing from our collaborators, those who've been with us throughout this journey over the last year. They will be doing some introductions, and they will be sharing with you their experience of being part of this collaboration. And then before going into the Q&A, I will be sharing with you some of the big updates that we have planned for this year. So without further ado, I think it would be useful to start with some of the barriers and opportunities that we identified about 1 year ago when we started this venture. I'm sure you will be familiar with many of this. This will resonate, particularly the opportunities. But what we try to mitigate through this open source tool, this interactive dashboard, was some of the historic barriers that the sector had been dealing with for quite some time. And I'm sure the first one is probably the one that you are struggling the most with, like myself, in many occasions, and it's the availability of data. Quite often, we're looking for specific information about a given issue or maybe certain beneficiary groups, but maybe the data is not available out there, or there is data available out there which is really hard to navigate, access, and combine together. There is a lack of uniformity around data standards and taxonomy. I normally refer to this as the Tower of Babel syndrome. If you're not familiar with it, it's basically that phenomenon whereby you have many professionals working in the same sector, but describing the same phenomenon using completely different set of languages. And that's one of the issues that we struggle with data the most, particularly when we think about need data or even demand data. Data maturity is another issue. I know the things have been changing over the last year. The pandemic had put us in a position to kind of rethink how we use data, how we think data, and how we use that to inform our decision making. There is generally speaking, a fear and risk aversion about sharing your data, make that data and information and insight available for others to use and refer to. There's still some work that we need to do around data culture and the level of trust that we attach to data and data sources. And last but not least, innovation is not necessarily always a priority. However, I like to be positive, and I always think that with challenges and barriers comes opportunities, and that's some of the things that we've been trying to harness through this collaboration. And the data bank, what we called FIND, the Local Needs Data Bank, we hope that will enable the sector overall and you people and other users in the policy and advocacy settings as well to inform the decision making by making use of need and demand data, so the ability to triangulate those different types of information, so that this will generate more adaptive programming, better use of evidence, and potentially improve impact measurement techniques, and also improve how people and organizations collaborate within the sector and beyond. So what we tried to do for this data bank was to effectively create a condition for a data-driven response. So about 1 year ago, I know it sounds crazy, we've been in this situation for 1 year, so light is eventually the end of the tunnel. We're getting out of there, but there's still work that needs to be done. So in a time of unprecedented crisis, what we tried to do was to create a set of resources for funders, charities, and philanthropists and policymakers out there to make use of data to inform the decision making. The first step was launching an interactive online dashboard. And I know that some of my colleagues will be sharing the link pretty soon to the dashboard, which could enable users to generate insights based on need data available out there, mostly through official sources, but I'm going to cover that in a second. And then, more importantly, we then incorporated data provided directly from charities. We have some of those partners with us here today who will be sharing their experience of being part of this venture, but this is the probably most important component of this dashboard, because what we tried to do was to mitigate some of the limitation that comes with need data. As we know, there are lots of official sources out there, government stats, etc. But arguably, most of this data is actually historical data. It usually refers to 1 year before, or maybe it's not necessarily relevant and the most up-to-date data. So it's really hard to use that to inform decision making. It serves as a good proxy, but it doesn't give you the full picture of what's actually happening on the ground. And that's why we thought that it was crucial to include what we refer to as demand data, so the data provided directly from charities, to enable users to maximize how they combine and triangulate data to inform the decision making. We know this is not perfect. It's a work in progress. We are not experts in every single areas that we try to cover for this dashboard, so from health to financial difficulties, etc. And that's why our inspiring principles, our approach to this type of work is to constantly review, implement, update, and share the things that we learn and the insights and research that we managed to generate through this collaboration. So just to give you a rough overview of the content of the dashboard, we have 2 categories of data, if you like, which you will find that you can interact with on the data bank. First of which is the need data. So that's the official sources I was referring to. We combine all sorts of data released from the ONS, NHS, Public Health England, and what we used at the time, and to an extent what we're currently using, is what is actually known about the COVID-19 and the health and financial crisis that the current pandemic has generated. But we also integrated data coming from organizations such as NCVO and the Charity Commission data, particularly looking at local charity density, which should give you a sense of what is the local workforce available in each of the local authorities. So we use local authority actually as a kind of lens through which you can cut and slice the data, if you like, and this will enable users like yourself to get a sense of what is the picture, thinking about need and demand at local level, but also regional and national level. Our current focus in terms of kind of vulnerable groups, so the typology of data that we've been gathering has been mostly around elderly population and BAME. We all know now that it's a fact that those are groups who are particular risks, especially in case they contract the virus, but also because of all the inequalities and financial difficulties that emerged for the crisis, even though arguably most of them were actually still there, even before the crisis. And we also added data recently on lone parents, overcrowded households, but also children and young people. And that data, it's available alongside the latest data on COVID-19, from vaccinations to cases, infection rates, and unfortunately, the number of deaths and the rate. So the second category of data is demand data, what I referred to previously, and that's data coming from charities. So that data includes a variety of information from the programs and initiatives that those charities run. So benefit calculations, number of applications, number of awards, the value, but also demographic information about the beneficiaries that they've been supporting throughout 2020 and 2019 as well. And I want to emphasize that what we thought it was useful to have both sets of data, so for 2019 and 2020, in order to understand where and how around the country and all the different local authorities, the level of demand was changing. We believe this is a particularly powerful piece of information, mostly because it can enable user to identify not only areas where the demand is particularly high, but potentially those areas that are left behind or underserved. And the reasons could be multiple. Digital exclusions, maybe there is a good network of service providers available locally, or maybe they simply can't reach the organizations that might be in a position to support them. And we've been through this journey with Turn to Us and Bottle UK for most of the last year, and recently we're really pleased to say that British Gas Energy Trust join us. So we have also that data, which is quite rich and includes a variety of data around beneficiaries and the awards, but also we combine that data with the latest statistics on fuel poverty, because two reasons. First of all, it's relevant given what the charity does, but also because that's another indicator of inequalities and poverty, if you like. Excuse me. So if you haven't seen the dashboard yet, this is a screenshot to give you a sense of what is the content and layout of the dashboard. So the data bank is arranged in different pages, if you like. We have a user guide, which will give you all the information around what we've done so far, an overview of the data, how you can get in touch, and a bit of the history behind this particular initiative. We have a page which is entirely devoted to COVID statistics, what we called COVID tracker. And then the pages around those vulnerable groups that I mentioned before. So elderly population, BAME, lone parents, children and young people, followed by those pages where you can see and interact with the charity data. And I want to emphasize again, if you haven't seen the data bank, all of this content, it's interactive. So all the tables, charts, and maps you can see, you can interrogate, combine the data in different ways, and I'm going to cover that in a second. And all of the outputs you will see in the dashboard will update automatically. Again, we think that this is a way of making this data user-friendly, a lot more accessible, but please do get in touch if you think that we're missing out on some data that we haven't included yet, or if we think that we can make this tool a lot better and much more user-friendly. I'm also pleased to announce, to share with you, if you haven't seen it yet, one of the big updates that we have planned for early 2021. So originally, the content of the data was referring entirely to England, but we have now included data for all of the UK, with the exception for British Gas, which covers all the nations except for Northern Ireland. So there is a lot more data that you can use, and we were aware that that was one of the issues. We were not unlocking the power of data, if you like, for all of the devolved nations, but our main focus was England to begin with when we were building this tool. As I mentioned before, there is fuel poverty data, which we have recently added, latest statistics on child poverty. We do run weekly updates on COVID deaths, cases, and infection. But the most exciting bit for me is now there are filters that you guys can use to create your own data query. So you can filter the data by region, and you can select multiple regions if you want to compare, and you can drill down to local authority level. So you can, for instance, select whatever local authority you might be interested in, or if you want to make a comparison between specific region or local authorities, you can now do so. And we have also revised and implemented our list and linked to the original data sources that we use throughout the dashboard. And just a quick recap on why we're doing this. So we hope that this kind of tools and initiatives and collaborations will create the conditions to and the depository of data and knowledge and insight for a variety of organizations on local and national level to be able to access and make use of user-friendly data, improve how the evidence is used to inform programs, grant making, strategic priorities, and so forth. It's part of our goals for this kind of open source tools to become the new norm. And you're probably familiar with other similar initiatives that have been deployed since the beginning of the pandemic. To name one, the British Red Cross has created a health dashboard, which is extremely helpful to provide insight of what is the impact of the crisis and some of those inequalities, particularly with particularly thinking about health and health risk and indicators. We also hope that this kind of collaborations will empower local communities. Now more than ever, there is an emphasis and a need to understand how different local communities are coping with the current crisis, but also what are the crucial differences between different areas, and whether there is a need to identify specific approach which are likely to have a much better positive impact at local level as opposed to national level. We hope that this kind of initiative will help the sector to rethink and rebuild better. And last but not least, that potentially this will create the conditions for user voice to be heard. There is a lot of discussion around how we think and talk about need, the terminology that we use, what are the indicators that we use to describe those proportions of the populations who are in need or struggle. And so we hope that this will reinvigorate the debate as to why it's important to include beneficiaries and users in the design process and the implementation process of programs and grant making. And really what we're trying to do is to use data as a conduit, as a mean to improve the communications within the sector. We've seen lots of interesting initiatives, and we have been rethinking how we collaborate throughout the pandemic. But sometimes it still feels like the sector is disjoint. All the actors and players and organizations involved don't really talk to each other or communicate effectively. And we believe that data can effectively be the kind of common ground, common shared language that can help improve knowledge and efficiency and then social and positive impact. And this is where I hand over to our lovely partners who will be sharing their experience of being part of these collaborations, and they will do the introductions, tell you what they do and what this collaboration has meant to them. So over to you, Pip.
Hi everyone, it's really great to be here. I am Pip Johnson. I'm the head of Insight and Impact at Turn to Us. It's amazing to see all of you here today on small Zoom screens, but it's really great to be here. So thank you, Rosario. I'm going to share, Turn to Us has been involved with this project for the last year. I'll share a little bit of how and why Turn to Us is involved in the data bank, and some kind of thoughts and reflections on our own experiences of being part of this collaboration, why it's so important to us at Turn to Us as a charity, and why we believe it's so fundamental to the sector as well. So for anyone who's not heard of Turn to Us before, we are a national anti-poverty charity, and we provide support to people who are facing financial crisis, primarily through financial grants and through information and support to people so that they can access the services and the welfare that they have a right to. To give you some context, last year we provided £4 million in financial grants, and over 3 million people in the country checked their benefits on our online benefits calculator to see what they're entitled to. And as a sense of scale, last year before the pandemic hit, 14.5 million people in this country were in poverty, and that will only have risen since then. That's more than 1 in 5 of us. Thanks. Next slide, please, Rosario. And this kind of, I'm doing pictures all the way through because it's easier. This picture encapsulates what we're sharing with the data bank at the moment. So We're sharing all of our anonymized data that we collect through the benefits calculator. And each of those records that we are sharing represents someone doing exactly this. It represents a person who's logging onto our tools, who's looking for financial support at a time when they are in financial need. And the first reason why it's so important for Turn to Us to be part of this collaboration is because we want to share that data openly and ethically with the rest of the sector, so that all of that data that we are holding on actual humans in this country who are in financial need is accessible to everyone, so that we can all use and analyze it. Thanks. Next slide, please, Rosario. And this is, I'm going to talk a little bit about how we've actually been using the data bank. This is an actual slide graph from the data bank that NPC have produced for us. And I think it shows why this project is needed now more than ever. So this is a slide that's showing the users of our benefits calculator in 2019 and 2020. And that huge peak that you can see, I'm sure you can all guess, that is when the pandemic hit in March and April last year. Turn to Us saw a 270% increase in people using our services. And at the beginning of the pandemic, we had over 50,000 people checking their benefits each day. So the reason why this is so important that we all start sharing our service demand data as close to real time as we can is because the speed and the pace of change, not just in the kind of financial charity sector, but across all of the different parts of the charity sector, in how quickly the landscape is changing, mean that the faster we can all share our data, the quicker we can learn and act from it. And it is also so crucial that we then sense check and triangulate our own service data against the sector at large, so that we make the right decisions. So from our own research at Turn to Us and so much research across the sector this year, we know financially that the groups who have been hardest hit by the pandemic are also the groups who were struggling the most beforehand. So that includes part-time workers, women, Black, Asian, minority ethnic households, lone parents, again, mostly women, private renters, and people in areas of the country that are already the most deprived. And so the reason, when we started to kind of dig into this data with NPC as part of the data bank, in terms of the data of people who are using our benefits calculator, what we found was actually our service demand data was completely different from that national picture that we're seeing. So that huge spike that we had in 2020 was mostly driven by self-employed workers, men, and from people in the least deprived parts of the country, particularly the southeast. And so the reason why this data bank project is so important to Turn to Us is because unless we triangulate and compare our data to other sources, we could be making completely the wrong interpretation of where we should be targeting our support. And we could have come to the interpretation, if we were doing this on our own, that we needed to target our resources to the least deprived areas of the country. We all on this call know that that's not the case. Okay, next slide, please, Rosario, thanks. And I hope you'll forgive me the cheesy metaphor, but this is what I was thinking of in terms of why our efforts on the data bank are so important, because it feels like the sector is like this 1,000-piece jigsaw puzzle, right? And we all have this tiny snapshot into what the bigger picture is. And from our own pieces of that data puzzle, we can all draw our own conclusions, and they might be skewed, about what support people need, where and how we should be deploying our resources, and what policy changes are needed as a result. And going back to that example from the previous slide, if Turn to Us had been working alone, we would be coming to the wrong conclusion. Thanks. Next slide, please, Rosario. And so this for me is kind of where I feel like the data bank is at the moment. It feels really exciting. it feels like different people from across the charity sector are starting to coalesce and bring not only their pieces of data, their pieces of the puzzle together into like a slightly messy big pile at the moment, but we're also bringing our determination, our resources, our skills to kind of try and solve this problem. I know like there's other initiatives across the sector, but it feels like we are starting to get to this point where we know this is the right thing to do, and we're all trying to work out the next steps. And so we're starting to grow. You know, we've got British Gas Energy Trust, as Rosario said, have just joined. Very shortly, Royal London, who might be on this call, are also joining to provide their technical expertise to the project, which is amazing. If you're on the call, thank you, Royal London. And so it feels like, yeah, we're getting to this place where we're bringing all of our data into an open, accessible space. And we're getting to the point where we can start to see how our different pieces of the puzzle fit together. So for instance, the next step for Turn to Us and Buttle, I know Amelia's speaking next, is that we are going to start trying to combine our data sets together to see what our combined data says about levels of child poverty in the UK, especially during last year. What does our service demand data say about that? And this one, although it's a slightly boring picture, this is my vision for where the data bank will get to, is that we will have so many charities and other organizations involved, each sharing their own pieces of the puzzle, that we can actually build a comprehensive picture of need and of demand data. And that by combining all of our information on who, when, where, and why people are accessing the sector, we can build this proper picture of stuff. But so I'm like a data nerd. I love this stuff. The point of the data bank, this is not the end point of the data bank. The point of the data bank is not just to create loads of maps and graphs just for the sake of it, although that will be super useful. Next slide, please, Rosario. The point for Turn to Us and the potential power of this approach is about finding those gaps in our provision as a sector as a whole. I'm sorry, this picture might be like nostalgic for some people, might make people happy they've not seen it for a year. But the point is that we bring all that data together so that we can actually answer questions like who is receiving support from us as a sector compared to who needs our support, and how well are we as a sector meeting the current needs of people, whether that's financial, health, social needs. And if we're finding gaps, how can we then collectively rebalance? So for me personally at the moment, the power of the data bank will be in giving us those tools so that we can tackle, I mean, the gaps we're talking about, what that boils down to is inequality, inequity, and social injustice. But without completing this data puzzle, we can't truly answer those questions of how equitable our work is, or what actions as a sector we need to take. So going back to that question, you know, to that what we know about COVID at the beginning and the financial impact, I've recently really been asking myself that question of how well are we meeting the needs of the people who we know have been most impacted by COVID? We know who's been most impacted. We all have a piece of the puzzle about what the demand is. How well are we meeting that, and where are the gaps? And wouldn't that be so incredible to be able to answer that question? It would be amazing if we could answer that question, not so that we have the answer or the graphs or the maps, but so that we can then act on those answers. Thanks. So that's my experiences, that's my vision for what I hope the data bank will be. I'm so excited to see where we'll be in 6 months or a year, and I really hope lots of you will be on the journey with us. Thanks. I'll hand over.
Thank you, Pip. That was fantastic. And yes, I really like your point about being data geeks and data nerds, and appreciating what we've done with the dashboard. But really, this is meant for everyone. So if you As I said before, any comments, suggestions, or if there is anything that is not that user-friendly as I think it would be, please let us know. And over to Amelia now.
Thanks, Dario. So I am Amelia Smith, and I am Impact and Evaluation Manager at Bot UK, also a data nerd. So I'm going to talk a little bit about how we've been using the Local Needs Data Bank at Bot UK as an example of how charities and organisations can use the data and the insight that organisations can gain from being involved. So my slides are a bit more technical than Pip's, as they're specific examples of what we've been doing with the data, but hopefully they're easy enough to follow and I explain it clearly. So Bot UK is a charity that provides individually tailored grants to children and young people who are living in poverty and have been emotionally or educationally affected by crisis. So we deliver Chances for Children grants across the whole of the UK. During the pandemic, we've distributed around £4 million to around 3,000 families in crisis, which has been a massive step up from the 1.5 million we did last year prior to the pandemic. So we're in a position where we have a lot more data on the demand for children and families in crisis. Internally, we have a database that captures a lot of information about the needs, the characteristics and the demographics of the children and the young people that we receive applications for and the children that we support. We have our own internal dashboards that we use daily to monitor things like applications and our grant giving in general. But ultimately, we're a small organisation. We only have one data person, and there are internal limits to our capacity to continually monitor and share and draw all the insight from the heaps of data that we have available. We also, as an organisation, really value transparency, and we want to use our data to strive for improvements in our grant giving. We try as much as we can as well to take on opportunities to collaborate with others in a way that allows us to be a voice for the children and the young people that we support. So when NPC in turn to us approached us and asked us if we'd like to be involved, it was kind of a no-brainer. It allowed us to be transparent with our activities. It allowed us to highlight where in the UK we're reaching and seeing increased demand. And it also helps highlight the issues and the crises that children and young people are experiencing and how this is changing during COVID. It's also meant that we're more consciously and actively thinking about our grant giving in relation to where government and public data suggests that there is high need. And we don't have to do as much of the data admin around it. So on the data bank, it's all in one place. It's really easy to draw insight from when you don't have much time to do that. So everything across the data bank is presented at local authority level. At Bottle, because we have finite funds, we target our spend at a regional level. So that's how we create our targets. We're never going to be in a position to create local authority driven targets for grant giving because we don't have enough funds to reach all of the children and young people in need of our grants. So even with our massive increase in funding this year, if we tried to target every local authority, we'd actually only have enough for 13 families per local authority, which is not enough, obviously. But that doesn't mean that we can't use the data bank and the information within it to inform and support our grant giving. It just means that we need to find ways to use it that are within our capacity. So back at the start of the pandemic, NPC published a blog that I wrote about how we've been using the Local Needs Data Bank to support with our outreach activities. So every year in general, we'll see quiet spells in certain regions, or certain regions will fall a little bit behind target. And because we've had a big increase in funding available in the second half of this financial year because of COVID, from September onwards, we were actually in a position where we needed to do more outreach to organisations to be able to distribute our funds. So we used the data bank to inform and target our outreach to local authorities where there's high need. So in the blog, I wrote about how we used the lone parents dashboard in the data bank to inform outreach in London. So we focused on the local authorities where there are a high proportion of overcrowded lone parent households and where the index of child deprivation is high. So at this point, the children and young people's dashboard didn't exist. So the lone parent household dashboard was where the most relevant information for us was. So the table on the left in the slide is taken from the blog. Don't worry too much about the details, but the pink boxes on the left-hand column represent our top application local authorities, where there is also either a high child poverty, and or a high proportion of overcrowded lone parent households. So even just looking at this was great, as it showed that even though we don't actually have a formal process for targeting high need local authorities, the majority of our top local authority areas in London are already where the need is high. The orange boxes in the table are the local authority where there is high need in terms of overcrowded lone parent households and high child deprivation, but where we haven't seen many applications. So this is where we targeted our outreach in London. Back when I wrote the blog, I focused on our grant officer Luke's anecdotal feedback on using the data bank to inform his outreach, and he said that it had resulted in more inquiries and applications in these areas, and it had allowed him to identify organisations that we can distribute grants through that he didn't know about before. So I followed up with this by creating a graph in Buttle UK's database, which is on the right hand side. And to my relief, it shows that application levels have increased as a result of the outreach work that we did in these high need areas. So that graph just represents the local authorities that are all in the orange in the table. So we've been able to reach more children in higher need areas as a result of using the data bank to inform our outreach. So this kind of just shows that you can, organisations, even small ones, can use the data bank to inform their activities, and it's just about learning what's within your capacity and what's most beneficial to the children or the people that you intend to support. Next slide, please, Rosario. So I'll quickly go over another example of outreach, this time in the East Midlands, but showing how the same concept applies to the new children and young people's dashboard that's now up and running, and how actually, as we're going on and we're making developments to the dashboard, they're becoming even more user-friendly. So although this is the new dashboard and our outreach was done back in November, it's the same child needs statistics, so it is the same high need areas coming out. So on the left-hand side is a screenshot of the new children and young people's dashboard in the data bank. So the new developments make it even quicker and easier to see where child need is. The main child poverty statistic now shows the proportion of children in poverty after housing costs. This is much simpler to understand than the original proportion of children in the bottom 10 percentile of deprivation or whatever it was before. So it's now just easier to interpret and read. Also, the child poverty stat is now directly next to the population column. So this means that if we rank the local authorities in order of the proportion of children in poverty, we can now immediately see that in the East Midlands, Leicester, Nottingham and Derby are the highest areas of need because they have the highest proportion of children in poverty and the highest overall population. So there's more children in poverty in these areas. So this is where we did our outreach. Again, the graph on the right shows applications just for Leicester, Nottingham and Derby. You can see a massive spike around the time that our grant officer Kate did the outreach, but that this has declined at a bit of a steeper rate compared to the ones from the outreach that we did in London. We don't ordinarily formally monitor the effectiveness of outreach in our grant numbers in specific areas. So we would normally just look to see if spend is increasing in a region after outreach and hear about the applications from the grant officers themselves. But the process of engaging with the data bank, being part of the discussion within the team and having more of an investment in the data bank means that we've pushed ourselves to use this data more and have these kinds of conversations. So I sent both the graphs to the grant officers who did the outreach work, and they both thought that it was really great that the data shows the evidence of the hard work that they did. It's nice to be able to see in numbers for them that our applications have gone up where they put a lot of effort in. Equally, having the conversation with Kate about how the East Midlands applications dropped off again quite quickly highlighted to me that actually over the last couple of months, the majority of her applications in that area have now been coming from wider Nottinghamshire and Derbyshire. So we're still getting our money out there, which is ultimately our priority. So these conversations and the insight wouldn't have necessarily been a focus for us if it hadn't been because of our involvement in the data bank. So this kind of approach to outreach is also going to be even simpler when the new update comes out in a few weeks that allows us to add Buttle UK data to the same tables as the public and government data and put this again alongside demand data from other charities, because it will be even easier and quicker to understand need across the UK. So And also it means we won't have to go through the process of creating tables like the one that I had on the London slide. So it's just going to only be better and easier in the long run. Next slide, please, Rosario. Okay, so I'm now going to talk a little bit about how getting involved in the data bank has been really insightful beyond just looking at the location of our applications and the location of need. So at Buttle, when a family is awarded a grant, we assign award reasons, which represent the risks, the experiences, and the outcomes that have resulted in the children and young people needing a Chances for Children grant. So in our database, we have a lot of these reasons, and they're presented on the dashboard. So this picture on the left-hand side is a screenshot from the Buttle UK dashboard that shows the top reasons for award in London. So for example, in this screenshot, if you can see it, it shows that in London, our highest kind of need is child and young person behaviour problems and domestic abuse. Back in July last year, NPC used the data that was available on the Buttle UK dashboard to do an insight piece on how the needs of children and young people were changing through the pandemic. As there are so many reasons for award, they broke these down into different categories, such as at-risk adults affecting child status and child mental, physical and learning needs and exploited youth. They looked to see how rates of these different issues had increased or decreased in the first few months of the pandemic. It was really useful to have an outside perspective on how these different issues could be categorised, and the report that they produced provided some really good insight for us. So much so that we now use these categories internally to have a better understanding of our grant giving and its impact. So the little purple table down the bottom is just a screenshot from our impact report that we released in December, but we use the categories that NPC created as a way to present the needs of families in a way that's easier for readers to understand than just the big list of reasons that we have in our database. So the screenshot is just of the section that covers at-risk adults affecting child status, which includes things like domestic abuse, family breakdown, homelessness, and parent-carer mental health problems. So it's anything at the parent level that can have an impact on the child and mean they need support. So since we released our impact report, we've actually gone beyond using these categories just to present our grant giving data and have started to analyse our impact data against these categories to understand if there's any relationship between the risks or the needs of children and young people and the impact of our Chances for Children grants. Internally, we regularly have discussions about the groups that we support, thinking about where we can make the biggest difference and how we ensure that we avoid doing harm to children. So we always want to ensure that we make informed decisions about who to say no to when. So some of the discussions have touched on whether grants benefit certain groups of children based on their experiences more or less than others. But we have such a long list of reasons for support that it was really difficult to know where to begin. So the analysis done by NPC and their categorisation of our reasons have given us a great starting point for being able to understand the impact of our grants against need. So the graph on the right-hand side shows the improvements that are reported by families in our evaluation surveys against the number of factors family have under the at-risk adults affecting children's status category. So we assess improvements for families after receiving a grant across a range of outcomes that sit within our theory of change. So that includes children's well-being, their capacity to engage in education, the home environment, family relationships, and parent coping. So that's what each of those bars mean in the table. The deep purple bars represents that families that have 0 to 2 of the at-risk parents factors, and the lighter lilac bars represent families who have 3 or more. So the lilac bar equals greater crisis or risk. So you can see that the lilac bar is ever so slightly lower than the purple one, which gives a little bit of an indication that the impact of our grants might not be quite as high for the families where there are more parental crisis factors putting the children at risk. But we can also see that this difference is so tiny, so is nowhere near enough to indicate that we shouldn't be supporting these families with this level of risk. So being able to do analysis like this reinforces that we're reaching the children who need and can benefit from our support. So So overall, that's just a really long-winded way of saying that getting involved with the local needs data bank has really improved the way that we think about and utilise our data to inform our grant giving. It's improved our outreach practices, and it's led to massive developments in how we categorise our giving and assess our impact. A lot of the people that I've spoken to about the data bank in conversations have kind of raised concerns about being too small to be able to provide valuable data. But actually, I think the smaller organisations are kind of the ones that could benefit the same amount, or if not even more, by getting involved. Because the projects that we work on collectively increase organisations' capacity to use their data. And sometimes you just need other people to look at your data and give their insight into it to understand the value of the data that you have. So I'll just quickly finish by saying that from our experience at Buttle over the last year working with this group, I would recommend to anyone who can, does join, and not worry about being too small. Thanks.
Thanks, Amelia. That was really interesting. And as you said, you know, it's one of the benefits of being part of this initiative is the ability to discuss together, maybe rethink the amount of information you have access to, the data that you collect, but also how you deploy in practice the data to inform decision making. And I just want to emphasize again that, you know, one of the great aspects of this collaboration has been the level of transparency and open discussion among those partners who are directly involved, but also among all the other peoples that we've been engaging with and that been providing us with feedback and ideas on how we can make things better. Now, moving forward, now we're going to hear a bit from Jessica, who is the Chief Executive at the British Gas Energy Trust. And I just want to say once again, welcome to the group. British Gas has joined recently this initiative, and we have published the data last week alongside the first wave of big implementations that I shared with you previously. So over to you, Jessica.
Thank you very much, Rosario. As Rosario said, I'm Jessica. I'm the Chief Executive of the British Gas Energy Trust. I'm calling from Hampshire, and I wanted to give apologies in advance if my dog barks or snores, or you can hear the chickens outside. There was slight feedback earlier, so I'm going to stop my video in the hope that the audio is better. Hopefully you can all hear me. So this slide shows who we are and what we do, but I wanted to talk briefly about why we got involved, which will explain more of our aims as a trust and why this initiative and tool is so important. As the pandemic hit last March, the Trust had several programmes running, including a multi-year funding programme that was grant funding 30 energy and advice projects across England, Scotland and Wales. We'd also just launched a local response fund, which released additional grant to organisations delivering and gave them the ability to access local access interventions to buy things such as small energy efficiency measures, fuel vouchers and fees for debt reduction orders, things like that. Our 1.4 million responsive debt relief grant programme was also open for small grant applications to cover fuel debt for vulnerable fuel poor households. You can see more from the slide, the image on the right, the spread of the programmes and the funding we've awarded over the last year, and there's more info on our site. The challenge was this time last year, as the pandemic worsened, there wasn't an open trust grant programme that could support other vulnerable communities who are facing increasingly tough challenges due to the pandemic. All of our funds this time last year were committed. Next slide, please, Rosario. Thanks. This raised a big question for the board. As you can see from our theory of change, which is on the slide, our mission is to alleviate the detrimental impact of poverty. The COVID-19 pandemic was already reducing household incomes across Great Britain, with many more households struggling to meet their outgoing costs, including fuel bills. It was expected to also greatly increase demand on the advice sector, which was already under-resourced in many areas. Some groups, including those already in vulnerable situations, were already being hit much harder than others. And in the words of the Trust's chair, Helen Charlton, the severe social and economic repercussions of the pandemic were expected to be long-lasting and served as a harsh reminder of the pressing need for the Trust's and other funders' vital support for people struggling to meet their household bills, in particular energy costs. So as a trust, we needed to act, and it was in this context the trustees agreed to make another £800,000 available in additional funding. The challenge for us was where to focus it to do the most good and reach those most in need, whilst not overwhelming our very small team with applications we didn't have the resource to assess or the budget to fund. Next slide, please, Rosario. At the time, we conducted a mapping exercise ourselves, working with CSE, which resulted in an advice need index. The index combined a number of indicators that suggested a higher need for advice, including prevalence of indebtedness, employment, lone parents, and other indicators suggesting high fuel costs, as well as the British Red Cross data Rosario mentioned earlier. This resulted in high-level maps which showed us the geographical spread of advice need, alongside maps showing advice provision, alongside other maps which showed us other things, alongside maps which showed our coverage. The data, whilst okay, had a lot of challenges. Some of it was years old, it wasn't comprehensive, and it was a bit like combining chalk and cheese, but we were working with what we had access to. So whilst it wasn't as good as we wished, it did give us a basis for our focusing. However, it was challenging to aggregate and interpret. It took investment and it took several weeks to pull together, all of which delayed programme development and launch of the fund. However, from this, whilst it wasn't perfect, it did show that directing funding using mapping was the way forward. Through it, we targeted the fund to applications from advice charities in 9 new areas: Leicester, Sandwell and Walsall, Rossendale and Hyndburn, East London, Dundee, Yorkshire and Hastings. And as you'll all see several months later from the COVID tracking aspect of this support, several of these months later, these areas were amongst the worst affected, with devastating human loss and battling the social economic fallout of continuous lockdown. What we realised is we needed something more nuanced and more advanced, and this is where it was fantastic to meet and be introduced to Rosario and the team, because we realised and we share the ambition that if this sort of data is collected and shared openly, it's going to be of huge value to the sector, both funders and service organisations. We're absolutely committed to working with colleagues from Turn to Us, Buttle and NPC, and it was a moment of serendipity for us that we could add and share our data to collectively inform our understanding of provision gaps and identify trends, and this struck a chord with our mission and values as a funder. We're currently sharing anonymised data at a local authority level of the people and households who have applied for and been awarded energy debt relief grants. This slide shows the situation in Merseyside. Understanding this data at a local authority level helps us understand where the funds might not be being accessed as much as they could be when you're looking at the fuel poverty statistics for the area, or where local advice centres might need more support with understanding how to access the grant funding. By taking part and growing the data available, we ourselves can continue to develop the responsiveness and effectiveness and impact of our grant funding. And it won't stop here. In May, we'll be sharing data on the dashboard from the 9 COVID programme grants. This will show which clients have been helped and how over the 8-month grant period. Following that, we hope to share our collective impact framework data, which will show not only the quantitative statistics, but also explore how we share the outcomes data alongside this. So in short, as a funder, a relatively small funder who wants to get as much money out of the door as possible to the areas that need it most, this is a fantastic thing to have the privilege to be involved with. We're absolutely committed to it, and I would encourage other funders to get involved. I think that was my 5 minutes, Rosario. So I'll hand back to you. Any questions I'll take later.
Very well done, Jessica. Thank you. And it's great to have you on board as well. And you mentioned more data in May, so you just made my day, Matthew. Thanks for that. You can tell I'm a data geek. Right. Before going into the Q&A for the remaining half an hour or so of this session today, I wanted to share with all of you what is the second wave of big updates that we have planned for early 2021. So some of these features are already available on the dashboard. So currently you are able to filter any of the need and demand data looking at region, nation, where applicable, local authority. However, we acknowledge that the current content and layout is very much what we put together. And by we, I mean all the partners. So the tables, the charts, the maps, and we want to enable users to be able to actually create their own data query. So what we are going to release, and it's currently in the works, is 2 additional features. So yes, you will be able to filter the data by selecting multiple geographical areas, region, nation, local authority. But we want users to be able to select just those data points, thinking about need, for instance, so those official statistics that might be interesting to, if you're working with children and young people and all you want to know is just those statistics and maybe do a quick comparisons with some of the COVID data or other deprivation data, you will be able to select only those indicators you're interested in. And alongside that, the data, the demand data, so data shared by charities will be also available. So by default, you will see the total overall number of awards and benefit calculations and whatever other data we might be able to add in the future. So to see the kind of collective effort and response that those charities have been delivering on the ground in those areas that you are interested in based on the selection. But you're also able to just select specific charities if you're interested again in fuel poverty as opposed to children and young people and those who are in financial distress, for instance. So the good news is that like everybody else, everything else on the data bank, this is free for everyone to use. And you will be able to generate your own charts, tables, and interactive maps, which will automatically update based on those selection criteria. We are planning to release this sometimes in the upcoming weeks. This is still a work in progress. And as ever, this is a joint effort between ourselves at NPC and our partners, because we want this to be not just user-friendly, but to make sense and to be accessible. I mentioned before that among the various things that we have in the data bank, there is a link to a feedback survey. So again, if you used this data bank in the past, if you're planning to use it, please let us know if there is anything that we can do better or differently. And last but not least, what if you would like to join or contribute to this initiative? Amelia, Pip, and Jessica, they all mentioned this is open to everyone. So this is an initiative open to funders, philanthropists, charities, grassroots organizations, or even community-led organizations. There are no restrictions or requirement based on your organization's size or reach. The more we are, the better. We can only make this tool better together. And you can join and contribute in different ways. Obviously, you can contribute with your data, which I want to stress once again will be anonymized and aggregated. So obviously, at the heart of this collaboration, there is the willingness to avoid any harm or formal discriminations to the beneficiaries and users the data refers to. If you don't want to share your data, you can contribute with your knowledge and skills. I always said NPC, we do not deliver services directly. We do not interact with beneficiaries directly. So there is a lot that we can learn from organizations such the ones you work for, based on the beneficiaries you work with, the issues you exist to tackle, and the kind of local picture on the ground we might not be familiar with. You can also fund future implementation, research, and analysis of this dashboard if you're willing to do so. And final point, as I said before, you can contribute with your feedback. You can let us know what you think, whether it's working, whether it's not working, and how we can make things better in the future, maybe what data we should be considering for future implementations. And that was my last point. So now we're going to go into the Q&A. So feel free to, I know that some of you have been posting their questions in the chat, so we're going to look into this, but also feel free to unmute yourself and ask questions. Don't be shy, this is your chance to shine and ask all sorts of questions, even the difficult ones, and we will be happy to answer.
Everyone's very quiet, Rosario.
Yeah, I know. You know, it's people tend to be shy.
I've actually got them. I noticed something in the comments about standardization and data capture.
Yeah.
Rich Collins, I think, had said consistency of information. I think this is a really interesting point. We obviously fund an awful lot of organisations, and we've introduced something called a collective impact framework, which means they're all gathering the same data. So it means that the data that we'll be providing is all collected on the same basis, using the same questions, despite them all delivering in different ways. If you're interested in a bit more about that, I can help, but that's how we make sure our data is standardised that we provide.
Okay, I do actually have access to a few questions, so I'm gonna just read this for you guys. So the first one, which is quite interesting, it's actually one of my favorite subjects. This is from Mikkel. What about resistance to share data by local national government agencies? I can probably kick off on this one. This is a really good point, and that's one of the things that I was referring to at the beginning of this session today when I was talking about data that it might be available out there. It's really hard to access or use, or maybe it's not necessarily comprehensive or user-friendly. I know that there are a few things happening at the moment. It's probably worth mentioning what the ONS is doing around need data. So rethinking how data is collected and the categories available out there. I can give you a really quick example. We know that, demographic information around ethnicity and gender might not be the most up to date. And again, it's part of a historic data set that has been the same for ages. And it's 2021, so this year they're going to be running the census data again. So keep an eye on the website, because that's an open initiative. And if you would like to contribute, that's something that is definitely worth keeping in mind. And one final point, a bit more generally, I love data, combining data, all sorts of big data sets. That's my thing, which can seem quite sad at times, but it's actually also very interesting to do. I think this kind of initiative can give us collaborating together, rethinking how we use and understand need data, demand data, can actually give us collectively the means to then go back to local and national agencies to get them think what data they shared publicly, how often, for instance, and also raise questions around how relevant and up-to-date the data can actually be. One of the things we struggle with is to get data that is actually giving us an idea of what is the current picture of need. And we know that most of the data available out there, sadly, usually refers to 1 year before, maybe 5 years before, or it takes a while before it's released, and maybe it refers to a survey or data that has been gathered back in 2014. So again, I think collaborating together, working together to get new standards and understanding of the data and taxonomy and what are the requirements, what we need as a sector to make better informed decision. We can only, be more vocal if we work together.
I've got a question, Rosario. I'm
Hey,
Albert. Hi. My question is about, do you have any plans of converting some of the information that you have into social impact returns on social investment? I know it's a very, very difficult subject and very difficult to attribute this into a financial return, but I'm just wondering whether you have any plans of doing that.
The honest answer would be no. Disappointing, I know. And I can give you a bit of context as to why. So what we tried to do with this initiative so far was to collect data in one place, make it easy to access and interrogate. What we tried to avoid was to make any calculation or sophisticated statistical analysis, if you like, because we acknowledge that our own limitations. We are not experts in all the subjects that we're trying to cover, whether it's health, finance, and other inequalities. But we also wanted to create the conditions to move forward, to improve, and maybe create different resources. Hopefully in a future that is not so distant, the content of this data bank will be so big that we will have to categorize and group the data under different headings, if you like. Anything that is financial distress as opposed to well-being, health, etc., etc. And maybe we will be creating subgroups or working groups who will be focusing on pushing that agenda forward, if you like, and focusing on that data. And yes, I do appreciate it. It's quite fascinating. I used to work for the West London zone, so I'm a bit familiar with the model. And we do have actually colleagues at NPC who are specialized in that. But I think, quite frankly, we are far from that stage. Maybe not the answer you were looking for, but
Thank you, Rosario.
So going back to the questions. So this is a good one from Marcus. How might this database tie in with other databases like 360 Giving? I can kick off, or if any of the other speakers want to join, please say so. No, I will. Okay, good question. The short answer will be that's definitely part of the plan. So we don't see this effort as something that we are doing in isolation and in silo, but ideally we, in the future, we would like different data banks, dashboards, call it whatever way you like, communicating with each other. So we're not trying to replicate things that have been already done or are available out there. But imagine in my head, and probably this is my vision, if you could have the Charity Commission data set communicating with this type of resources like the data bank, but also this being linked to resources such as the GrandNav, 360 Giving, or maybe other data banks and resources like British Red Cross, where you can look at health indicators, health inequalities, and risk. So we are totally open to any conversation or collaborations with any other partner organization who have been working on similar resources. Yes, Jessica.
Can I jump in? From a funder perspective, I also think that if we can understand where other funding is being targeted, we can make sure that we're not overlaying it too heavily and all focusing it on the same area. And I think the liver time that is, the better. We all plan grant programs 3, 6, 9 months in advance. And if we're all planning for the same area, an area can go from being under-provided to over-provided, leaving other areas short. So I would really encourage funders to be open and share when they're planning their programs, because it'll help the money go further and go to where it's needed, because there's always going to be capacity and demand will always outstrip supply.
Brilliant. I have a question for Amelia from Ed. How much time did you need to commit to get value out of it?
Not too much, because we have our database ready. So in terms of handing over our data, it's pretty quick. It probably takes about 20 minutes each month to keep that live. And then Rosario does all the hard work of putting it into the dashboard. In terms of the insight, it's kind of hard to... I have my full-time job is doing data analysis within Buttle anyway, so it's already there, and this just provided a different method to kind of embed into what I was already doing. But probably like a couple of hours a month. And when it comes to doing the deeper analysis, when it comes to thinking about the insight, like where we were looking at the outreach, my database allowed me to do that in 5 minutes, and then we had a half an hour conversation about it. It wasn't a long thing, but I am also aware that we have the benefit of also having our database at the same time as being able to be part of the data bank. But I think part of it is to understand how you can embed the use of the data bank into your work without it taking too much extra time. I don't sit there for hours looking at it. We only go to it when we have the capacity to do it. We don't regularly monitor our grant giving against the needs on the dashboard. It's just as and when we feel like we're able to, and we don't want to put increased pressure on ourselves or increase targets within our charity because of the data that's on there. We just want to use it to support what we're doing when we can.
Albert, please go ahead.
Yeah, sorry, Rosario. I'm just thinking this is such a useful tool when all the different funders are contributing data to it. From your experience, Rosario, and listening to what Amelia said, potentially it is time and commitment from the funder to be able to gather data as one of the barriers for the funder to share that data. From your experience, Rosario, what are the other barriers that potentially funders are facing that is not enabling them to share data with NPC?
Good question. I can only guess. But what I would say, it's capacity is definitely an issue. I think it takes time, and especially at the very beginning of this collaboration, and I think Pete, Amelia, and Jessica will second that as well. We spent a lot of time working together. First of all, assessing what data is available. So what is the data that you are collecting, and potentially do you need to publish all of it? And usually the answer is no. You don't need all of it. So, and secondly, once the core data set is identified, there is this further discussion and collaboration around how we're going to aggregate that data. Obviously, for this data bank, we opted to use data to display data local authority level because geography, in a way, was a quick and easy way to harmonize all these different data sets. And secondly, we go through the outputs, the charts, and the proposed layout together. Does it make sense? Is it actually reflecting what the data has been telling you internally? Is it fit for purpose? Is it going to convey the message that we are hoping it will convey? So what is the level of need around, I don't know, fuel poverty as opposed to those who are are victims of domestic abuse? Is it clear? So it takes a while to get there. I would say probably roughly speaking, and guys, jump in and correct me if I'm wrong, at least a couple of months at the beginning. But the beauty of it is that once you get past that stage, everything else is straightforward because we have agreed how we're going to implement the data and update the data, add new things. Particularly for funders, it's a slightly different thing, I think. It really depends whether you're supporting organizations directly as opposed to beneficiaries, or maybe whether you have a mixed model where you're doing both. And quite frankly, I think on top of capacity, as I mentioned before, and there is a bit of risk aversion. And I totally get that. It's not easy to make that decision where you say, okay, from now on, I'm going to share my data, what I do publicly for others to see. And whether, especially if you're a small or medium organization, that could be a big deterrent. What we're trying to do for the data bank is not to say bigger organizations are reaching a huge number of people. On the contrary, we're trying to get everyone on board because it doesn't matter how small or big you are, there is value in the information that you are collecting. There is value in your knowledge of the issues that you exist to tackle. And there is definitely value in the insight and perspectives you can bring to these conversations. We don't have all the answers. We're not expert on every single subject that we're trying to cover. And we have our own vision, which might not be necessarily shared by others, particularly when we're thinking about how the data is displayed or shared. So yeah, over to you guys. I don't want to just give my point of view. Sorry, Amelia, go ahead.
That's all right. It's not even just about the numerical data that you have to be able to put on the data bank. It's about being able to look at the data bank, seeing what other charities' data is showing, and then even if it's kind of working together to give insight on a blog or something like that, where smaller organisations can use their more qualitative data and the expertise from the people that work in those organisations to give a context behind the numbers that are on the data bank. So it's not a case of, oh, you need to give us your numbers or you can't be involved. It's about stimulating those conversations. Or if you're small organisations that don't necessarily collect the data, but you also know that there are other issues that aren't currently represented on our dashboard, getting involved in having those conversations with us and helping us understand how we might be able to use additional data from other sources as well to better present the needs of people in crisis. It's not just about organisations having numbers on applications or whatever it is that they're doing. It's about data in terms of broader insight as well.
I just saw one of the questions being posed, and it was in my mind as well to ask that. Earlier on in your presentation, Rosario, you said that definitions and of the different issues are very interpreted differently for different organizations. Is there a plan to, I guess, move towards a common language so that everybody will be able to understand what those definitions mean and what they mean to the organizations for them to be able to all sing on the same hymn sheet?
Potentially, yes. I mean, I see this as a natural outcome of these types of collaborations. Now, I don't expect that we're going to get with a list of categories which will make everyone happy or will answer all sorts of questions or capture all the different aspects of needs and demand data. But inevitably, this collaboration has put ourselves, so all of us involved, and also to an extent internally in the respective organizations to rethink about the categories and terminology that we've been using. I think Amelia gave a really good example, thinking about the reasons for awarding grants to those children and families in need. A long list of categories, which is absolutely insightful, but then at the same time, it's too much. Yeah. So is there anything that we can do to simplify and harmonize that language, how we refer to X, Y, and Z issues? And again, I don't expect that we will come up with the final definitive and perfect answers of set of categories, but having that conversation or create the conditions for that debate to happen will inevitably have some sort of positive effect. There could be also negative effects, obviously. And I've seen in the chat that some people have rightly so pointed out that, you know, there is an argument around the definition, what constitutes full poverty as opposed to crisis, as opposed to any other issue you can think of. But that's good. This is healthy debate. And that's the kind of debate that, going back to one of the points that was made before, we can then together collectively bring back to local and national governments and policymakers. Are you thinking about need? Are you describing people in crisis in the right way? Are you empowering those organizations that exist to serve them? But more importantly, are you empowering end users who quite often are left behind or are just limited to a set of labels and categories, for instance? So yes, I really hope that we will get to that point as well, where we reach some sort of common ground and understanding on how we refer to and describe need and demand and again, the people.
Yes, Zoe, can I just jump in? I think this is really interesting, especially around the fuel poverty point. So from our perspective, what I'm interested in seeing over the coming sort of weeks and years is how actually the two overlay. So you've overlaid the fuel poverty statistics, but actually, if we're then putting in data ourselves on what we understand and where the grants are going on financial vulnerability, low income, ethnicity, age group, disability, we might notice where things don't align, which will raise very interesting discussions in itself on whether the definition is correct, because we'll have evidence that actually it might not be in certain areas or not picking up on the right vulnerable households.
Yeah, Pip, Amelia, I don't know if there is anything you would like to add.
Yeah, I would just agree with Jessica. I was thinking exactly the same thing. I love the idea of a collective impact framework, I think you called it. And there might be hopefully non-contentious things that we can all agree on. You know, there's just standard things around age and other demographics that are so standardized that we can all share our data in exactly the same way. And then there's other things where, yeah, we are trying to, these are categories that you're putting across 60 million people. They don't fit neatly, and you can categorize people in whatever way you want and overlay that over the messiness of real life. And actually the value of the data bank and of the data query next stage that Rosario is working on is that we'll be able to compare those different ways of categorizing, those different ways of deriving meaning from our work, and we can compare and contrast and see what that difference looks like. I think that's actually, standardizing too far would lose some of the value, I think, of the sector. Thanks.
Mikkel, you have your hand up.
Yes, thank you. I suppose my question, well, I've mentioned that already, what happens if the government are resistant to share data? A couple of years ago, when the big society agenda was still around, the government were actually sort of interested in sharing their data. And one of the things that we found beneficial as an organization were the proxies for social return on investment, well, the values of different interventions that used to be on the Cabinet Office website. They were on the Cabinet Office website because at that time the Office for Civil Society were part of the Cabinet Office. Now the Office of the Civil Society has moved across somewhere else. That data is not available. I spent about 3 hours trying to find it. Perhaps NPC, I mean, could ask if that data is available, because I don't understand the reason why it isn't. Someone has spent money on this. And I know some of it might be, they're old now, but guess what? I know how to calculate the inflation, so I can easily upgrade that. And I don't know if it's a genuine a case of something being overlooked, or the government not wanting people to be able to compare that data or use it. Recently, my organization has spent a lot of time on creating our SROI strategy. We are a small organization, we have 9 staff members, and I don't know why I should be spending more time just because the government don't want to share something they've already spent money on doing. I don't think it would cost too much for them to put it there. Not just the government though, the lottery fund had SROI, useful SROI information, including health and well-being, and they've a report on that, and I think they have also taken that down. I've actually asked them to put that back because I couldn't, and it has been put back, but I can't talk to the government and tell them to do that. But I think suppose people like NPC could possibly try to say that this is important for the civil society, because we can't collect all that data, and we need help. Thank you.
Good point. I wish we had that direct line with the government. We don't, unfortunately, but I totally hear you. I mean, we struggle similarly. It's a completely different context, but really it's a similar example. The child poverty stats at some point were pulled out from the government, just out of the blue. They were there, they've been used by lots of organizations, and I used to be part under a different role of the Hen Child Poverty Coalition. So if any of you knows them, you know that they've been fighting the good fight to convince the government to actually publish again statistics on child poverty, some of which are currently available on the data bank. I don't really know why social return of investment data is not there anymore. I mean, I did mention that we have colleagues at NPC who are, that's their area, so I'm a bit out of that comfort zone. But long story short, I mean, if there are organizations out there who are interested into this, the best thing to do would be to just make noise together. Again, sadly, sometimes when we try to fix issues, we do this in isolation because it takes time to set up collaborations. It's time consuming, etc. But it's a really good point. If it's there, if money and time has been invested in that particular set of resources, there's no reason why it shouldn't be available. And I wonder whether the old-fashioned freedom of information request might do the trick in this case or not. But that would be my advice, I guess.
Rosario, you mentioned that one of your colleagues in NPC work on SROI. Do you guys share information, data? So will they get to see this data set that all the different funders have shared and somehow manipulate it and translate it into SROI?
Good question. I don't think we got to that stage yet. I mean, it's worth remembering that the way the NPC work, yes, we are a think tank, we do innovation and development, but we also do consultancy work. So, I think it's fair to say that quite often it's also based on what kind of relationship we do have with our clients of the organizations that we work with. We do have good relationship and knowledge and network worldwide. And maybe it's worth mentioning one of the latest initiatives that we've been part of, which is quite useful, and I think they're doing a pretty good job. It's the Go Lab from Oxford. They created, it's still kind of beta early stage version, but it's a depository of knowledge and data for all the social return of investment initiatives and impact bonds happening around the world, so not just UK. And I know that it's a quite niche yet interesting area. I mean, we do have processes whereby we share knowledge internally, the things that we learn, but like any other charity, we have finite resources, so we can only do the best we can with the time we got. Maybe in the future, who knows? But and I would be more than happy to put you in touch with my colleagues who are experts in that area. Some of them are here today, but I'm not going to point the finger because I'm going to play nice. There was a couple more questions in the chat, which I'm going to read to the group. So there was an interesting one from Helen. Is there a danger that because the dashboard only shows participating organizations' data, a very self-selecting picture arises which doesn't match well into the real picture? And how could we mitigate against this? So I'm going to ask any of you, Jessica, Pip, and Amelia, I'm looking at you to answer this one.
I was just thinking about this. So we've been doing some analysis from the dashboard as well to mark a year of COVID that we'll be releasing next week. And we were looking at those risk factors and how proportionately they've increased or decreased beyond absolute numbers. And we haven't seen an increase in families where the parent or carer is experiencing substance or alcohol misuse. And we know from organisations that support in those areas that that problem has increased through COVID, but we're not seeing it. So I guess it's just about coming out and saying that the data that's on this dashboard isn't necessarily representative of everyone across the UK, and just having a knowledge of that and being small organisations and then doing the research to say, actually, although our data is showing this, other organisations that actually specialise in this area in particular are showing this. And so it's just about being transparent and open with that and making sure that people understand that those numbers don't represent everyone in the UK when it is organisations that are working with smaller amount of data. But that doesn't mean that the data that's up there isn't valuable either.
Can I jump in? Is that okay?
Yes, you can, of course.
Thanks. And I think this is really interesting because, of course, if we're showing with both our grants data and the next round of data with regards to advice sessions given, if it's just showing the advice sessions funded across the BGET project, it's going to look as if there's vast swathes of the country which aren't getting advice sessions, but of course they will be served by other citizens' advices and other advice and money advice services that we're not funding. And I think this is why it's really important to focus on encouraging as many organisations to contribute as possible. So we've got that picture, but also using benchmark data, so using the government data, aligning it to DWP data or other things we can sort of cross-reference to, but also being very clear in the descriptor what our data does and doesn't cover. I think that from our perspective, it'd be wonderful to see the citizens' advice data out there, because of course they've got CABs which we don't fund in areas that we're not in. Trust data, that sort of thing. I think the more interventions we're showing, the more accurate picture we get. But until that happens, I think we've just got to look at it carefully and explain carefully what it is and isn't.
Yeah, good point. And I just wanted to reiterate that this is a constant work in progress. We know it's not perfect. It's not going to give you all the answers you're looking for. But what we're trying to do is to take this, the opportunity that the pandemic has somehow given us to accelerate a process that we were trying to get going in the past as well. And we're not saying that this will be the final solution, the final tool. It might be that in the future, somebody else will come up with a better idea, or maybe those people will join us. But this is, again, we're trying to create the condition for that change, to rethink and rebuild how we do things in the sector. And we are 1 minute away from the end. So I want to address the final question from Daisy about breakdown of the BAME population. Daisy was asking whether there is a way or data that to access where you have a full breakdown of the ethnic groups. The answer is yes. So what we currently have in the data bank is the population estimates, one of the many data sets released by the ONS. And I will be happy to share, the link is actually in the dashboard as well, but I'll be happy to follow up separately on email. The reason why we group BAME is not because we do not acknowledge that those are effectively different ethnic groups, but it was in the attempt to simplify the amount of content displayed in the data bank. There is always a risk with data, and I call it the data trap, that there is so much data available out there. You want to share all of that data, you want to capture all of it, and then enable other users to use it. But we opted for simplifying in this case. Might not be the best approach, so we're totally open to any criticism or suggestion. But again, this was done in the context of COVID and the newly emerged evidence at the time that those who were part of BAME population were actually exposed to higher health and financial risks. So short answer, yes, there is data with a full breakdown. It's the ONS population estimates by ethnic groups, if you're interested into the data set, and I will be happy to share a direct link with you afterwards. And this is the end, I'm afraid. So first of all, I would like to thank the speakers for their contribution, for being part of this crazy venture, but quite interesting one. I would like to extend my thanks to all of you for being here with us today. I really hope that this session today has inspired you to make much more use of data, potentially to join us. And maybe, if I can be a bit cheeky, to decide whether you would like to fund this initiative. We're all charities, so we're familiar with the limitations around money and capacity and time. We will continue, regardless, to do that. So watch the space, because there will be more updates coming. We are open to anyone who would like to join, contribute with their skills. And final point, otherwise my colleagues in comms will kill me if I don't say so. There is a link to a feedback survey for this session today. And because we love data and we love gathering even more data, please take the time to complete it. Let us know what you think, the goods, the bads, and we will work hard to make things better next time. So again, big thanks to all of you for being here today. Big thanks to the speakers. Get in touch if you have any questions. We will be following up on email with the recording and other resources and the slides as well. It was really good to see you all, and thanks for being here today.
Thanks, Rosario.